So I was born in New Orleans, Louisiana, and my mom and I then moved to Texas when I was young. I did my undergraduate training at Texas A&M University in College Station, Gig'em, and that's actually where I met my husband. I did my medical school training at the University of Texas Medical Branch down in Galveston, and then my pediatric residency training, I went to Children's Medical Center in Dallas. I ended up staying an extra year at Children's in Dallas as a Pediatric Chief Resident and an attending at the hospital there. And then I joined a outpatient private practice in one of the Dallas suburbs for a couple of years. And then with my husband is from Baton Rouge, and we had our third child on the way, and so we made the decision to get back closer to home. So that's what brought us back to Baton Rouge in October 2013, and then I had the privilege of joining the clinic in November of that year. Becoming a pediatrician is something I wanted to do from a very early age. I was always the doctor to my Cabbage Patch Kids, and they all had Band-Aids everywhere to prove that. And as a little girl, my mom tells me now, she said, "You said you were going to be a pediatrician from the time you were young, and that's what you wanted to do." And that truly is where my passion lies. You know, during medical school, you get to experience different areas of medicine, and there are certain areas I did enjoy as well, but nothing that I was passionate about other than pediatrics. So I knew that is what I wanted to do, and I feel blessed to be able to do it now. I think my favorite part is getting to establish those relationships with families. You know, when a baby is born, you get to kind of be there from the beginning, and that's such a special bond that you get to establish with families and see their children grow up. And you know, as a mom, I know for my kids, I want to have a pediatrician who I can trust and who is there to listen to me and understand the things that I'm going through. And so I really enjoy getting to do that for families and be that listening ear, be that person who wants to know their concerns, wants to help them through some of those rough patches. You know, being a parent is quite a roller coaster ride, and sometimes you just need a little guidance along the way. I think the things that parents really appreciate the most right now is just how connected they can be with the clinic through, say, the MyChart system. I have many parents who will email me. Well, in today's day and age with parents, that's their main way of communicating, is through email and electronically. And so that has been one thing parents just really have appreciated, is being able to send me those questions. I can respond back to them through email as well. So I know parents have really appreciated that. Also, I hear day in and day out just how much they appreciate having things like lab services and x-ray here at the clinic. So if they don't have to go anywhere else, I get those results back, I get to interpret them and look at them. It just is a kind of a really nice to have everything in one place, especially when you're having to go around. You don't want to have to go around town with your kiddo in tow.